I'm going to show you now how to prepare the urethral catheterization device, the UCD, and then insert the UCD in a patient who failed standard catheterization. So we have a pair of sterile gloves to put on. And we have already placed the UCD onto a sterile surface. The first thing you want to do is to activate, to lubricate the guide wire. So you take the guide wire stopper, which is actually a lure lock ready to fit a syringe, whether it's a screw top or a nose, and actually inject saline or water, and that is now ready to go. You just double check that you haven't accidentally disconnected the lure lock as you were removing the syringe. That is actually snugly fitting into that sidearm, and that's where it should stay. So for the catheterization procedure with the UCD, you again would want to lubricate the urethra, and you straighten the penis and inject some jelly. Remember that the patient was already draped. He has had already an attempt where the catheter would not advance into the bladder, where you felt resistance and you abandoned, in order to actually ensure safe, non-traumatic catheterization with the UCD. We are now taking the UCD still in the inner sheath so that the guide wire isn't flicking around, and place the device onto the patient's abdomen. And then we can slowly remove here the inner sleeve again, that the guide wire doesn't spring out. And the first thing is we want to now insert the guide wire. You hold it about 7 centimeters from the tip so that you have a little bit of better control of the floppy tip. And then you straighten the penis, and then with slow, smooth, even advancing movements, you insert the guide wire, and that drags the catheter automatically behind. Now, as you advance this guide wire, it will curl up in the bladder, so it won't damage the bladder. It will have bypassed an enlarged prostate gland, and now the catheter is automatically dragged behind and cannot go, but only into the bladder beyond any enlargement of the prostate gland. Now you want to insert the catheter to the very end, just to ensure that the catheter is truly in the bladder. By now you should see urine coming out from the central drainage lumen, and that is the safest sign for you to actually allow the balloon to be blown up. The Foley balloon is inflated by attaching a syringe with water to the valve of the balloon. Make sure that it's not kinked here, so you support it with your finger well, and push the syringe in properly, and then slowly inflate 10 milliliters of water so that the balloon is fully inflated. And then you disconnect the syringe. Now you can remove the guide wire, because the balloon, the inflated balloon, is keeping the catheter safely in place. And then you can attach your urine bag to the central drainage lumen and close the side cap if you don't require irrigation. And then you just gently tuck the catheter back until it bounces until the balloon bounces at the bladder neck. And that is the correct placement of the catheter safely in the bladder. Now, when you want to remove any Foley balloon catheter, you need an empty 10 ml syringe and you attach that again to the valve. The orange is a color code for the size 16. You push the nozzle of the syringe firmly into the valve, and again make sure that it isn't kinked, that it is straight. You want to support that with your fingers, and then slowly aspirate the fluid from the balloon. And you need to be aware that you can't quite know for sure how much volume was inserted by the previous practitioner. So you really need to feel that negative pressure as you aspirate. And sometimes you're not quite sure, having reached the end of the syringe, whether there is still more fluid in the balloon to come. And the safest way is to actually disconnect, create a bit more space in the syringe or empty it altogether, and just do it a second time. So just aspirate, and you now clearly have negative pressure, no more fluid is coming out, and you know the balloon is empty. And then you slowly, gently remove the catheter, and the catheter is out. Now I'm going to show you here with the catheter on the patient's dummy what I've just done inside the patient, so that you actually can see what happens to this balloon. So remember, we started off with a device with an integrated guide wire, and you can see here nicely that the guide wire is running in the wall of the catheter. And that is quite critical, because when the guide wire runs in the wall of the catheter, then it cannot obstruct the central drainage lumen of the catheter, and it comes out here at the nice round Nelaton tip. So that is actually quite nice to see. Okay, so I'm just putting it back in. Because we want to now see what we have done basically without putting it in. So we started off inserting the guide wire. We held it sort of 7 centimeters from the tip, so it's not so floppy. And we insert it into a straightened penis to get a straight path into the urethra and avoid a kink here at the penoscrotal junction. So we insert the guide wire with straight, even movements, sensitive touch, and you automatically drag the catheter behind, because it's one unit. The guide wire and the catheter is just one unit. So if you now take over the catheter, the guide wire curls further in the bladder and drags the catheter behind. You advance the catheter over the guide wire until the very end. But should you feel resistance as you try to pass the catheter, don't force it, abandon. And then we were blowing up the balloon, firmly pushing in the syringe, making sure it doesn't kink. Do that slowly. And you now can see how this Foley balloon at the end of the catheter is inflated. And urine is now draining from the side channels of the catheter. You can attach a urine bag already if it's a mess. But only now do we remove the guide wire, when we know that the balloon is inflated and the catheter can't fall out anymore. Here we go. Remove it. And the side cap can be closed if you don't like bladder irrigation. But if you like bladder irrigation and there are clinical situations where that is desirable, then you could attach an irrigation system and irrigate the bladder. Through that guide wire channel, which is of course the irrigation channel of a 3-way Foley catheter design. Voila. So if you now, I can show you again the deflation, and you want to deflate the balloon, you again ensure that there is no kink in the valve, keep that straight, push the nozzle in properly, and then slowly, everything is slowly, smooth, slowly aspirate the fluid out of the balloon. And here we got 10 mils, but you may come to the point where you say, oh yeah, there is now negative pressure, but can't be quite sure, is there more fluid coming or not? To be safe, and it's always good to be safe, better than sorry. Push it back in, and now you really see there's no more fluid coming out, and you really have negative pressure. You disconnect, and then you can slowly and safely remove the catheter. And it's all done. Thank you for watching. I hope you enjoyed yourself. We had a fantastic time here sharing our experience with the UCD. If you want to see more, we have lots more of information on the website. Thanks for joining.